Hello, my name is Dylann Lowery, and I am a doctoral student in Florida State University's MFT program. Today, I will be discussing the article of a test of the dyadic associations between ineffective arguing, emotional distress, and violence perpetration and victimization among couples seeking therapy that was written by myself, Dr. Joshua Novak, Dr. Lenore McWey, and Dr. Scott Ketring. This article examines dyadic association between couples' ineffective arguing, emotional distress, and intimate partner violence, both victimization and perpetration. I'll refer to it as IPV from now on. Previous research has tested associations between ineffective arguing and emotional distress without including relationship violence. Other studies have shown associations between physical violence perpetration and victimization in the aftermath of emotional distress. However, there has been little research examining all three variables together. This is important because intuitively, there may be links between arguing, distress, and IPV. Findings from my study revealed some interesting patterns. Among the 231 married heterosexual couples included in this sample, higher level of men's ineffective arguing were positively associated with men's physical violence perpetration, both directly and indirectly, through higher levels of emotional distress. Higher levels of men's ineffective arguing were associated with lower men's physical violence perpetration through higher levels of women's emotional distress. Interestingly, these pathways were not significant for women. There are several plausible explanations for these findings. Perhaps, in the context of a partner's emotional distress, men reevaluate their perceptions of the conflict and their contributions to it. Or maybe men exhibit less aggressive behavior when sensing their partner's distress, even amidst their own. These results can inform the clinical treatment of interpersonal violence by targeting ineffective arguing and emotional distress. It is important for clinicians to know the levels of distress members of a couple experiencing and track progress throughout treatment. It is also important to address emotional distress. Past research has found that motivating individuals to think about their own contributions to conflict led to improvement in the couple's effective arguing skills, but it didn't account for how heightened emotions can take over an individual's reasoning in the moment and disrupt their ability to appropriately respond in an argument. An inability to regulate one's own emotions can lead to destructive communication patterns. Taken together, the effective regulation of emotions is important for effective arguing. Systemic therapists can help clients build those skills. Of course, though, with all research, this study has had its limitations. So future research should examine LGBTQIA+ relationships, observations of couples' interaction patterns, and longitudinal data. This study highlighted the importance of understanding ineffective arguing, emotional distress, and physical violence perpetration among couples, particularly for men. Findings point to the importance of assessing IPV when working with couples who present for treatment. If IPV is present, and after appropriate empirically supported IPV-specific interventions have resulted in desired outcomes, systemic therapists can work with the couples to promote more effective communication skills and attend to the emotional distress. Systemic therapists should be attuned to a couple's process, specifically how ineffective arguing and emotional distress affect one's own experiences and their partner's experiences. Findings from this research suggest that couples' ineffective arguing and emotional distress may be important mechanisms of change. Thank you.